You touched on adrenal fatigue. What's the difference between that and adrenal exhaustion?
Well, I don't personally condone, promote, or believe in the use of either one of those terms.
Okay.
Again, because it's misleading and it doesn't truly describe the physiology of what's really happening. It's not that the adrenals become fatigued, and then the idea of exhaustion is when it gets past the point of fatigue, and exhaustion is where there's just absolute no turning back. And it doesn't happen that way. It doesn't happen that way. There are many, many other things that are involved in how the adrenals produce cortisol. And again, the majority of the research that's been done, and there's extensive research that's been done, do not show the adrenal glands as the primary reason for low cortisol.
What are some of those reasons then for low cortisol?
Well, chronic infections, and I can get into the logistics if you want, but if someone has a chronic infection, the body will purposely keep cortisol low because cortisol suppresses your immune system. And when you have an infection, you want your immune system to work to kill the virus or whatever the infection is. So in that situation, sometimes the body is preventing the cortisol from going up in order to improve the organism's ability to fight off the infection. There's, just to complicate things even further, there are receptors. So all of these hormones have to work by binding to a receptor on the cell. And there are multiple kinds of glucocorticoid or cortisol receptors. And if there's a genetic malfunction of those receptors, or there are not enough receptors or too many receptors, those can affect whether or not cortisol is going to be effective, or even if it's there, it might not work very well. Vitamin deficiencies. Vitamin C, for instance, very high concentrations of that vitamin in the adrenal glands. And so sometimes the adrenal glands can't make cortisol because there's not enough vitamin C in the reserve of the adrenal gland to allow the response to occur. And there are literally 25 or 30 different variations of the problem being in the hypothalamus, the problem being in the pituitary gland, receptors at all levels being affected in some way. Cortisol hormone resistance is very well described, where the cortisol can be there, but patients the tissues can't sense it. So they have all of these states of low cortisol, which primarily manifest as fatigue, sensitivity to stress, and chronic pain syndromes. And so their cortisol might look fine, but they truly have those symptoms of low cortisol because their tissues can't sense the cortisol that is there. So there are lots of other reasons why either the cortisol levels can be low or they're there but they can't work.